Millions of dollars in federal money could be coming to Maryland to help battle the opioid epidemic. WMAR2 News' Abby Isaacs has details on what it would do to help cities like Baltimore.
We are facing a major crisis.
As the opioid epidemic rages on.
In our country, 115 people are dying every day.
Overdoses claiming lives and tearing families apart. A major amount of money may soon be coming.
$10 billion per year.
Congressman Elijah Cummings and Senator Elizabeth Warren introduced opioid legislation this week to provide states and local communities most in need with funding to prevent and treat substance abuse.
Other communities know what they need and know what they believe will solve their problems.
Some of the money from the Comprehensive Addiction Resources Emergency, or CARE Act, will be split between states. Maryland would get $98 million, Baltimore City around $13 million of that. Baltimore City Health Commissioner Dr. Lena Wen helped with the idea of the program. In a statement, she said, "In Baltimore, we're being limited in our ability to save lives. We need specific and sustained funding directly to local jurisdictions that are the hardest hit. Cities and counties are at the forefront of the opioid epidemic. We know what works." Separate money from the CARE Act will fund an expansion of the life-saving overdose reversal drug Naloxone.
If you were to talk to Dr. Wen, she would tell you that she has a very limited amount of this medication, and that every day she has to figure out who she's going to give it to.
He's also focused on changing the stigma around addiction.
People said, just like with AIDS, they said, oh, that's a moral failing. But it's a disease, and we need to treat it like that.
Cummings expects the act to pass next session. In Baltimore, Abby Isaacs, WMAR2 News.